On a busy street on the west side of Chicago, a nonprofit organization has been quietly making a difference to hundreds of people over the past 15 years. It's time more people got to know the Westside Health Authority, bringing the community's vision to life. So what exactly is the Westside Health Authority? It's a way to involve community residents into caring for children. It's dedicated professionals helping people find jobs or gain new technology skills. It's a resource for the community to access better health care. And it's guidance for formerly incarcerated individuals to help them re-enter society in a positive way. But the purpose of the Westside Health Authority, or WHA, is not just offering services and care. Its mission is to give residents an opportunity to shape the community's vision and build their capacity to bring about sustainable change. The foundation of WHA's work is the initiative called Every Block a Village.
Every block a village is taken from the African proverb, it takes a village to raise a child. And we go on the blocks and it's about relationships. We've come away from our culture. We've come away from knowing who our next door neighbor is. So it's knowing your neighbor. It's helping your neighbor. If someone is sick on the block, then you find out what you can do. We're talking about beautification. We're talking about where our children could come and play safely. It's loving, caring, and sharing. So that's what Every Block a Village is.
EVV is out there to help, to motivate our kids, to give our kids strong values. We need to come together as a whole. Every block is a village. It takes a village to raise children. And this is what's important. This is our future generation. That's where EVV is helping us to come together as a whole.
I have seen a transformation in a number of different ways since I began here at Westside Health Authority. And I think the one that is the most lasting impression for me is the whole Every Block a Village component. I think in the process of us just getting busy and the demands of life and working, the Every Block a Village has kind of given us an opportunity to kind of slow down and say hello to your neighbor and to kind of be kind.
Well, my vision in starting this organization was to create an opportunity for people in the community to have a voice in shaping health in their own neighborhood. So many times when you think about health, you think about medicine, you think about doctors. And a lot of the conversation had been around how can we improve access to medical care. But a lot of the things that people can do in the neighborhood can improve health. And when we start to ask the question, people begin to talk about things such as, well, I think if we had more jobs, I think if we had a better economic situation in our community, those things also impact health. So we wanted to have people basically determine what is health and how do you go about the business of creating community health.
You can't be healthy, you can't be okay if there's no good income coming inside. I think the challenges for us is that we're small, we don't have the fund, we don't have the resources to provide the help that's necessary for the majority of the people that request our services. That's a major problem for us, funding. We need the resources, we need the fund to provide those services for the people that request them.
Our program ranges from community residents ages 18 years of age and older, which means that we actually have seniors in the program, who are actually coming here to actually take the classes. With us having this technology program, not only is it empowering people and building capacity, but it's also giving people a sense of inspiration that I can do better in my life.
By having supportive services, CSAC, Community Support Advisory Council, it enables the individuals to receive the services that are needed, which in turn reduces recidivism, the return rate of individuals returning into incarceration, and promotes public safety. In the community, for many years, it has lacked supportive services and programs for individuals returning. With the CSAC, it provides an infrastructure for the individuals to return, and therefore they're not wandering and walking the streets with no place to turn.
If it takes a village to raise a child, what does it take to make a village? And we thought that if we begin to identify people who could serve as surrogates on the block, people who could mentor children right on their block. We could begin to make a difference with our children. We could offer them opportunities. Austin has the largest number of foster kids in the city of Chicago. And so many of our children do not know what it's like to be in a loving family, a permanent loving family. But they can know what it's like to be in a real community of families.
The youth department at the Westside Health Authority is very important to the community because we provide before and after school care to children who would not otherwise have valuable or safe alternatives. We provide sports activities, academic support, mentoring, adult programming, and life skills. We also have a play lot adjacent to the facility that the community was instrumental in getting built. So we provide a safe haven for children. We provide a loving environment. We provide warm meals for them. And we provide a supportive staff with skills to give to the children. And they love coming.
Through faith, hard work, and community support, WHA built the Austin Wellness Center, expanding healthcare services and promoting health and wellness to Westside residents.
I think the value of Westside Health Authority building the Wellness Center has really given the community strength to know that they can make a difference in their community. For, I want to say 40 years, there had not been a new building built in Austin until Westside Health Authority, helped the community members to make their dreams a reality. So it's actually a result of what the community actually sought out and accomplished.
In the Austin community, we have a shortage of really good, clean, safe clinics and hospitals in our neighborhood, and many are closing every day. So for us to be able to establish and to kind of ensure that, at least for the time being, that Cook County Outpost isn't going anywhere is important for the healthcare of this community, because some people may not make it to county, they may not make it to other neighboring hospitals, but they feel an ownership and they feel a sense of obligation and a sense of entitlement to be able to use that facility, and they should.
And today, thanks to feedback at monthly EBV meetings, WHA is beginning to focus on the need for the development of a Westside Cultural Center.
It is so important to have a Westside Cultural Center.
It's good when we can have, such things as a cultural center in our community, because number one, it basically gives us a sense of ownership. This is ours.
We now have to go out of our community for a lot of services, like to have a banquet. This is wonderful to have something at a wonderful place, but just think of the ownership that families would have and our community would feel when we had our own banquet in our own community, that we could raise funds and have a Mother's Day function at a banquet hall that we owned, that the community got together to build.
To just have a place to come where the Afro-American culture can be exhibited.
We need it. We needed to get our kids off the street and in something productive for them.
The kids have no place to go to do music or anything like that, to practice or otherwise, tap dancing. They have no place to do those things.
I would like to have, dancing, and not just hip-hop, but ballet, because everybody don't do hip-hop. I would like to see maybe a choir, because some people like to sing, maybe an art room, a music room, more varieties for more people.
A center where children will feel safe, learning new skills and studying their heritage. And most of all, a center for the entire West Side to enjoy the cultural arts together.
This cultural arts center will be a place in our community where mothers can come and watch their children play the piano and piano recitals, where children can come and have tap dance lessons and violin lessons, where artists can come and learn how to paint and draw pictures, where people can have on display their artwork. We think this will be a tremendous opportunity for us as adults to provide something lasting in our community for our children to understand who they are and what gifts we really have. And we know that this Cultural Arts Center is going to be a real blessing in our community.
Today, with your help, hand in hand, the vision of a new Westside Cultural Center can come to life. That's because we're all about serving the community. We're about faith, trust, and love. And we're about using the light within each of us to shine on and on and on. Westside Health Authority, bringing the community's vision to life.
Yeah.